Good afternoon, everyone, and welcome. While we wait for more people to join our national call today, please feel free to drop in the chat your name, your location, and where you work. We will get started in a few seconds. We just want to get more people to join the call today. All right, we'll go ahead and get started. Good afternoon and welcome to our official national call about the 2024 Black Maternal Health Week campaign that takes place annually, April 11th through 17th. I am Angela Doinsala-Aina, co-founder and executive director of the Black Mamas Matter Alliance, Incorporated, or better known as BMMA. The aim of today's national call is to share some key information about the purpose of the campaign and where to find more information on how you can support and participate in this year's campaign. The theme this year is Our Bodies Still Belong to Us, Reproductive Justice Now. We'll share some of the activities we have planned so far and provide some guidance on how you can engage with us throughout the week, both with BMMA directly and in your own communities. But first, before we get started, I would like to cover some logistical items. Everyone is currently muted and will stay muted during the call. To enable closed capturing, click on the closed capturing button near the bottom of your screen. If you don't see it there, you should find it by clicking more. At the end of our presentation, we'll answer a few questions, so please utilize the Q&A box to submit any questions that may arise. Now, I will pass it over to our wonderful digital media and development associate, Asia.
Thank you, Angela, for that introduction. So BMMA would like to thank everyone for taking the time today to learn more about what we're planning for Black Maternal Health Week 2024. We really do appreciate your interest, support, and commitment to improving maternal health for Black mamas, birthing people, and their communities. As the founding organization behind Black Maternal Health Week, the Black Mamas Matter Alliance is so excited to see all the ways it has grown over the past 7 years, and we look forward to seeing it continue to grow with your involvement and your support. Our agenda will cover the Black Maternal Health Week 24 itinerary, sponsorships, vendors, and exciting sneak peeks into partner activities where to find information about local events. The Black Mamas Matter Alliance, Incorporated, is a national network of Black women-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. Our alliance includes a diverse range of professionals from midwives and doulas to OBGYNs, nurses, lawyers, academics, and public health researchers. Our mission is to center Black mamas to advocate, drive research, build power, and shift culture for the Black maternal health, rights, and justice. So our work falls into 4 main bucket areas. As BMMA, we approach our work through the goals of working to change policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes, to cultivate research that leverages community knowledge and Black scholarship, to advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas' care, and to shift culture by dismantling negative narratives on Black motherhood and amplifying the voices and experiences of Black mamas. As efforts to address maternal health inequities in the U.S. continue, we must be more intentional about centering the ingenuity of Black-led maternal equity initiatives across the country and globally that are really making a difference. This is the primary function of Black Maternal Health Week. Of particular note, we use the phrase Black mamas to include a range of birthing people, cis women, trans folks, and gender nonconforming individuals that are of African descent across the diaspora. To those who care for and mother our families and our communities, whether they have given birth or not, we stand in solidarity with all Black mamas. Now I will pass it over to our Black Maternal Health Regional Organizer, Sainabu.
Thank you, Asia, for the introduction. Founded in 2018 by BMMA, Black Maternal Health Week intentionally takes place in April, which is recognized in the United States as the National Minority Health Month. Additionally, we begin Black Maternal Health Week on April 11th annually to join dozens of global organizations in marking this day as International Day for Maternal Health and Rights, an opportunity to advocate for the elimination of maternal mortality globally. For BMMA, we recognize maternal mortality as a global crisis that affects Black women, not only here in the United States, but across the world. Since 2021, Black Maternal Health Week has been nationally recognized by the White House. The purpose of this campaign is to deepen the national conversation about Black maternal health so that public stakeholders understand how root causes, such as systemic racism, acts as drivers of maternal health inequities. This campaign will center the voices, scholarship, work, and experiences of Black mamas, Black birthing people, and their communities. A primary goal of the campaign is to amplify the policy, research, and care solutions that are being harnessed in communities of color. The campaign will also inform policymakers and community leaders on policy solutions and will showcase to the general public the power of organizing and the importance and necessity of maintaining space for Black leadership in this work. And we are so excited that this is our 7th anniversary of Black Maternal Health Week. I want to take this time to thank all of our sponsors and alliance partners for a spectacular and highly impactful 2023 campaign. Through our large network of Black perinatal, maternal, and reproductive healthcare professionals, we hosted approximately 200 events across the nation, reached 1 billion people via our various platforms with our Black Maternal Health Week 23 tweet chat, which became a top 10 trending topic on Twitter, and garnered about 1,500 registrants across 2 webinar series and over 1,000 attendees. We're also able to host over 200 participants in our annual Black Maternal Health Walk in Atlanta, Georgia. More details on the impact of the 2023 campaign can be found in our year-end impact report on the homepage of our website at blackmamasmatter.org. Passing it back to Angela to describe this year's theme.
Thank you, Sainabu. The official theme for our 2024 Black Maternal Health Week campaign is Our Bodies Still Belong to Us, Reproductive Justice Now. Each year's Black Maternal Health Week theme is carefully chosen by our alliance partners to ensure that it succinctly captures the ethos and spirit behind our collective efforts to amplify the voices, perspectives, and lived experiences of Black women and birthing people. We know that widespread restrictions on abortion care access, coupled with rising cases of criminalization due to pregnancy loss, continue to widen the gaps of adverse maternal and birth outcomes in the United States. Many of the states with the most restrictive abortion bans have the worst maternal and child health outcomes and the least supportive social welfare and family support programs, particularly for Black women and birthing people. The time is now to demand comprehensive public and private insurance coverage for maternal, sexual, and reproductive health care, improving access to care across geographies and birth settings, issuing guidance to healthcare providers, institutions, insurance companies, and related entities on providing equitable, high-quality patient-centered care, and funding research and programs that center and utilize the scholarship of Black women and birthing people. The events and programming planned for Black Maternal Health Week 2024 will fully embody this theme and offers opportunities to engage in activities and conversations that honor the values and traditions of the reproductive justice and birth justice movements. Passing it back to you, Senegal.
Thanks, Angela. We are super excited to put this year's theme into practice with a full week of engaging and informative events and activities. Kicking off the week on April 11th by commemorating the International Day of Maternal Health and Rights through a social media activation campaign. In addition, we will be recognizing and honoring Black Doula Day through an enlightening digital activation. On April 12th, join us for a virtual webinar showcasing newly released resources and findings on evidence-based approaches focused on BMMA's workforce development efforts in relation to Black maternal health. On April 13th, get ready to move with us again as we return with the 3rd annual Black Maternal Health Walk in Atlanta, Georgia. Be sure to check out the Black Maternal Health Toolkit to learn more about how you too can join us. On April 14th, calling all advocates. This day offers a unique opportunity to share impactful videos, calls to action, and personal birthing journey moments of Black birthing people, with the goal of amplifying the voices of those dedicated to reproductive and birth justice movement. On April 15th, get involved and show your support for sustaining Black maternal health initiatives. Join the fight to end maternal mortality by becoming a donor as a part of our hashtag Fund Black Mamas, mobilizing capital for Black maternal health. On April 16th, join us as we discuss the importance of faith and policy in Black maternal health and reproductive justice with Black women experts and scholars in the field. Closing out Black Maternal Health Week 24 on April 17th, get to know BMMA's network of Black-led organizations dedicated to creating a world where Black mamas and families have the rights, respect, and resources to thrive before, during, and after pregnancy. Passing it back to you, Angela.
We urge you to get involved. Visit blackmamasmatter.org and follow our hashtag BMHW24 to stay up to date on ways you can participate. We like to take this time to express our deep gratitude to all of our Black Maternal Health Week sponsors from previous years and thank our current sponsors of this year's campaign. You can become a sponsor too. We welcome businesses, organizations, and agencies to be official sponsors and supporters of the Black maternal health rights and justice movement. Asia?
We are so excited to offer multiple tiers of sponsorship levels in support of this year's campaign. So whether you decide to be an upholder, supporter, advocate, or change maker, your sponsorship comes with many benefits and will help to sustain our efforts in amplifying Black leadership and care work in addressing maternal health inequities. So fill out our BMHW24 sponsorship and vendor form today by going to bit.ly/BMMA sponsor. We also have volunteer opportunities on a rolling basis. If you are interested, please sign up via our e-newsletter and stay connected. I will pass it back to Angela to discuss some upcoming local events.
Thank you. Our national network of alliance partners and other Black-led community-based birth and reproductive justice organizations are at the center of why we created the National Black Maternal Health Week campaign. Support, collaborate, and engage in local events hosted by our alliance, which can be found on our website. We encourage everyone to check out our local events page to see if an official BMHW24 event is hosted near you. You can also stay connected by signing up for our e-newsletter and following us across all of our social media accounts. We want to give you a sneak peek into into some exciting activities and events our partners have in store within their respective communities for Black Maternal Health Week. Starting us off is Gabrielle Albert from For Cure for Moms.
Okay, there you go. I thought I was talking, but I'm not. So good afternoon, everyone. My apologies for that. Thank you to Black Mamas Matter for having us on our call today and for partnering with us. We are excited about the Maternal Health Week coming up. Specifically as we are partnering with Black Mamas Matter for the April 13th Black Maternal Health Walk, as well as Block Party. With For Cure for Moms, we are an organization that was unfortunately founded by our founder, Charles Johnson, who lost his wife, Kira Johnson, 8 years ago to Black maternal mortality. As a result, he's dedicated his life's work to educating, advocating, supporting, and demanding campaign and legislation for how to we improve and eradicate maternal health, and specifically Black maternal health and mortality. So our 4-step process for doing that, number one, is through education. How can we empower mothers and other families to be informed? And so that's working with local partners, having different events, media, to make sure that we are able to get the word out and get people to understand that this is a crisis that can not only be solved, but it is unfortunately more discriminatory towards the Black and brown bodies, and we need to figure out a way to fix that. Number two, we advocate. And so we advocate for policies that promote maternal health and safe motherhood. We partner with both private and community-based organizations on the state as well as on the national levels. And more importantly, we believe in support. And so we have the maternal mortality response team. And this is where we work with local partners. Right now, Walmart is one of our corporate partners, because our goal is to make sure that within 72 hours, unfortunately, if a woman has died from pregnancy-related complications, that we can provide support to her family, specifically from practical baby care supplies, child care support, emotional support, as well as legal support. And finally, through campaign and legislation, specifically the Kira Johnson Act, which is funding to the community organizations, as well as to provide training, specifically on bias and racism. How do we improve respectful maternal guidelines? And also such as the Monmouth Act, which is Representatives Lauren Underwood and Cory Booker, are two of the major pieces of legislation that Charles and the organization have been working on. I will lead our info in the chat, but hopefully we will see you here in Atlanta for those who can make it on April 13th for our walk and our and community block party. Thank you.
Thank you so much for sharing the exciting activities being hosted by For Cure for Moms. Next, we have the lovely Okunshala Amadu, the founder and CEO of Jamaa Birth Village.
Good afternoon, everyone. Thank you so very much, Angela and Black Mamas Matter Alliance. It's an honor to be here with you all today, all the way from Ferguson, Missouri. And I am excited to share with you all some amazing Black Maternal Health Week events that we have planned. Just a little bit about Jamaa Birth Village. We're a Black maternal health organization, 9 years old, located in Ferguson, Missouri, which is within the St. Louis metropolitan area and in the state of Missouri. We are trailblazers and pioneers of creating a Black doula and Black midwife movement, where we used to have a gap where there were a very small group of Black doulas and 0 Black midwives serving our region. So we've been able to grow this community to make sure that Black women and families have access to community-based care. And we also work at the legislative and state and hospital systems level to ensure that policies, procedures, and and bills and legislation help to reflect the needs of the birth worker community and of the families. So in harmony with that, we are excited to announce Black Doula Day. And Black Doula Day takes place on April 11th, and we are launching this in partnership with Black Mamas Matter Alliance, and we're planning a pep rally, and we'll go into details in just a bit on the next slide. Before we go more into Black Doula Day, we also want to share excitingly that we are hosting with statewide partners Missouri's first annual Black Maternal Health Summit. This will take place in Columbia, Missouri this year, and every year it'll rotate around the state, so keep us on your radar so you can come and be in space with us. It will take place between April 16th and 17th, with April 16th being a Black Maternal Health Policy Day at our Capitol in alignment with Black Mamas Matter Alliance Policy Day. So if you're in the Midwest particularly and you're not used to working with politicians and legislators, we invite you to come out so that you can learn from us and go back to your state and your city and do the work. And on the 17th, we will have our actual summit where we will have the Honorable Jenny Joseph to open up. So we're going to the next slide. And we're going to talk a bit about Black Doula Day. So it was originally coined by myself in 2022, and we had 5 proclamations from Cori Bush all the way down to the local level on that day that honored Black Doula Day and also the Black Maternal Health Movement from national maternal health organizations. So this year we have partnered with multiple Black maternal health organizations, as well as Black Mamas Matter Alliance, which is Ancient Song, Atlanta Doula Collective, Southern Birth Justice Network, and Village Birth International. Together, we've created demands to elevate, protect, and advance the doula profession. Those 7 core demands for Black Doula Day is to highlight the misconceptions of what doulas can or can't do, to differentiate between a doula and a midwife. We also want to make sure that doulas are paid an equitable wage at our second demand. And that means that the minimum reimbursement wage is $1,500, and we all know it should be more. Our third demand is to make sure that community-based and BIPOC-led organizations and doulas in the state are included as experts whenever we're going through the process of drafting legislation and reimbursement. So we're going to help you all make sure that you can do that in your own state. Doulas also are not used or exploited as a solution or a bandage to the biased healthcare system. That's coming in at the 4th demand. Our 5th demand: mental health care is prioritized for BIPOC doulas who are continuously traumatized while attending births, and many birth workers have complicated personal lives due to the sacrifice of being on call and carrying the burden of the system. Our 6th demand is to recognize that doulas belong to the community and not the state. And states should not limit the type of training that doulas can take and certify with. Number 7, we want to normalize the care components, not the title or the colonialism and the word or profession. Doulas can also be called birth companions, birth workers, and much more. Now, how can you get involved? Make sure to follow us on social media at Jamaa Birth Village. Also, stay tuned to our website, jamaabirthvillage.org. Both websites launch on March 1st for Black Doula Day and Missouri's Black Maternal Health Summit. Thank you, and we cannot wait to celebrate with you all. Lastly, besides us hosting a pep rally, everyone in their individual state can have on-the-ground events, and we're going to send you all toolkits so that you can do just that. Take care, and I'll hand it back over to you, Black Mamas Matter Alliance.
I know that's right. Thank you, Akunshila,
You're
for a thrilling week ahead for Black Maternal Health Week from Jamaa Birth Village. Up next, we have Salima McNeil, the founder of Oshun Family Center. Salima, what does Oshun have in store for us?
Thank you. First of all, I am so excited about Black Doula Day and everything we got going on this year. So thank you for uplifting that message and sharing with everybody. And March 1st is my birthday, y'all. So I'm happy to celebrate with that coming up as well. Thank you so much for creating this platform to the BMMA staff and team, for birth workers and organizations and legislators to learn and uplift the narrative of Black birthing families. I have embodied that since the beginning of my career to establish Oshun Family Center in 2018, and have been on this journey all the way from Philadelphia to help uplift the work that you all are doing, that we all are doing nationwide here in Philadelphia. At Oshun Family Center, we provide racially concordant care, which includes mental health services and access to birth workers, which are doulas and lactation consultants, holistic healers. We work in conjunction with the health system on multiple levels to get them to understand how racism impacts Black bodies. We work on an interpersonal level with providing every client that we have within our research study with a doula, a lactation consultant, and a mental health professional for screenings for perinatal mood and anxiety disorders. And we are also lead organizers here in Philadelphia and have been since 2019 for Black Maternal Health Week. We have so many things that we want to share with you all. And what you've seen first was our save the date for our upcoming week. And what you see now is the full lineup of what we have going on. Each year, it gets bigger, it gets better. We have more community organizations that come out and provide resources. We have more community-based organizations that work with us to collaborate, because collaboration over competition on any given day and every day, because we have a shared mission of uplifting the work that we're doing to help eradicate Black maternal morbidity and mortality. We are also doing something very special that I'll share with you at the end. So as you can see, we are kicking off with our partners from New Voices that will do the Black Maternal Health Week kickoff virtually with our Lunch and Learn. Then we do a brunch, a Black birth workers brunch. This year's theme is Petals and Prosecco because we do cheer. And this event is sold out every year. This is the third year that we will be hosting brunch. And every year, if it's one thing Black girls going to do, if we go on brunch, and we do it very well. Last year, we had a community baby shower where we serviced over 200 families at one of our parks in a centralized area in North Philadelphia at Smith Playground. We're going to run that back again and hope to reach even more families. We're also doing a Well Mama event where we have holistic healers and a retreat style healers that will provide the services to the members that will come out on that day. On Monday, we will have our Reimagine Reproductive Justice training. We will have our call to action on Tuesday, which is also in collaboration with the PA Black Maternal Health Caucus that's led by state representatives Morgan Cephas, Gina Curry, and Latasha Mays. And then New Voices will be bringing it home on that Wednesday for a happy hour wind down for the week. We are so excited to see how things grow every single year and to have more collaborators, more sponsors, and more community-based organizations that are uplifting this message in a way that feels good to support the narrative of Black birthing families that don't rely on Black trauma to be successful, and that we put joy back into our lives and our stories together. And lastly, we are embarking on a capital fundraising campaign to open up our very own brick and mortar location here in Philadelphia to help support those services that we give already virtually, but in a space where families can come in and get the services that we need. So we welcome all of you to come spring 2025, fingers crossed, and send us good vibes that construction goes well, that we will be opening the doors to our very own maternal wellness village here in Philadelphia. Thank you so much for your time today, and please follow us on Instagram, and we have our websites posted in the chat as well. Back to you, Angela.
Yes, blessings to you, Salima, and all of your endeavors. Thank you. So much to look forward to with Oshun. Our next alliance partner is the Foundation for Black Women's Wellness. We have Michaela Berry Smith to give us a sneak peek of what they have planned.
Hello, everyone. Good afternoon. Thank you, Angela. Thank you, BMMA, for your partnership and the opportunity to lift up the Foundation's events for our week. I am Michaela Berry Smith. I am the Senior Manager of Community and Maternal Child Health Initiatives here at the Foundation for Black Women's Wellness, where we are headquartered in Madison, Wisconsin. We are celebrating 15 years of radically transforming Black women's health by creating a world where Black women and girls and their families live long, happy, and thriving lives defined by healthy minds, bodies, and spirits. If you don't mind clicking to the next slide. Our first event to kick off BMHW 24 is our CPR class for new and expecting parents that participate in our doula and community health worker services. So this is just a class that is part of our wellness classes to empower and give parents the necessary tools in case of an emergency. And that's something that we take pride in our wellness classes. Next slide, please. We are also proud to be hosting our 4th annual Black Maternal and Child Health Alliance Summit. This year is Forging Forward for Black Maternal Health. This is this is our 4th year, and this summit has grown to become one of the most important spaces where we're able to collaborate, not just with our stakeholders statewide, but also with our stakeholders nationally to discuss, envision, plan, and commit to transformational change in the Black maternal and child health arena. We will convene again this year on the heels of Black Maternal Health Week, and we do it in the spirit of power, healing, hope, and collective action to be the change that we seek in all of our communities. We thank you again, BMMA, for always uplifting this month and our particular week. And we hope that you will join us for our 4th annual summit. Our registration is live, so you can go to our website and subscribe to our newsletter. We will roll out more information on breakouts and our keynote speaker coming in the next few weeks. And we hope that you all get the rest that you need and the self-love as we gear up for this wonderful time. Thank you for having me.
Wonderful, wonderful. Thank you, Michaela, for sharing the Foundation for Black Women's Wellness's activities for Black Maternal Health Week. Now, rounded us up, we have Andrea Williams Muhammad from Missouri Makia Birth Cooperative. Andrea?
Nurturer and guardian of an idea and concept created by one of my comrades in Baltimore, Kiana Huff. Her dream was to create a family wellness and birthing center based on traditional African concepts and practices that was solely based in community and went beyond and fully operated outside of colonialistic and capitalistic models of care and business structure that would be independent and self-sustaining solely within and for and by community. As part of this effort, we are opening and launching our call for visionary membership to set the foundation for a cooperative of advocates, scholars, and providers across the reproductive spectrum to begin to bring this concept to life. The cooperative model inherently eliminates the need for competition between members while fostering community where everyone prospers, not only in their health, but in their economic sustainability and growth. This model is for organizations to not only work within their geographical location, but also connect with other organizations across the country outside of the nonprofit and grant-based business structures that can create barriers to access and are often unsustainable. With this, we will be working with our first community cooperative member, Mothers of Abraham, Daughters of Hagar, a community service and advocacy group that centers the voice of Muslim women within the reproductive justice and rights sphere. While religion often is seen outside of our work, Muslim women firmly believe and would like to share with the world our unique perspective because many of the hot button and urgency surrounding abortion rights is something that is inherently a right of all Muslim women. We are also fostering a more collaborative effort with members here in Seattle to bring local events and highlight those advocates currently working in Seattle and have been creating authentic space and share them with the rest of the country. We ask you to join us and learn more by contacting me by email at info@missourimalkia.org. Thank you. And back to you, Angela.
Thank you so much, Andrea. Thank you, thank you, thank you. Thank you to all of our partners and alliance partners for giving us a taste of what you can see happen during Black Maternal Health Week 2024. And we have plenty more partners across the nation, and will be uploading their local events as well on our local events page and across our social media. We hope you all are getting excited, and I'll pass it over to Sinabu.
Thank you, Angela. This year, for our Black Maternal Health Week 2024 Toolkit, will be released on Friday, March 15th, 2024. The toolkit will contain key messaging, statistics, graphics, assets, and the official Black Maternal Health Week 24 itinerary. You will be able to access this on our website at blackmamasmatter.org. As a reminder, BMMA's logos, including the Black Maternal Health Week 24 logo, are proprietary. We discourage unauthorized usage of the logos. The names, trademarks, service marks, and logo of BMMA appearing on this site may not be used in any advertising, publicity, or otherwise indicated BMMA's sponsorship of or affiliation with any product or service without BMMA's prior expressed written consent. You can, however, use the official hashtags for Black Maternal Health Week, which is further described in the Black Maternal Health Week Toolkit that will be released mid-March. You can forward all general Black Maternal Health Week 24 inquiries to bmhw@blackmamasmatter.org and media and press inquiries to press@humanimpactsolutions.com. As a courtesy, we ask that you allow 48 to 72 hours for a response as our team is working diligently to create an engaging campaign. We have a late breaker abstracts open for our Black Maternal Health Conference and Training Institute happening from September 12th through 14th in Atlanta, Georgia. Please be sure to follow us on Instagram at BMH Conference and on Facebook at BMH Conference for more information on the conference and where to submit your abstracts. Now we'll take a few questions from our Q&A box. We received one question from the Q&A box that is asking us to speak a little bit more about the tweet chat. Angela or Asia, would you like to share more information about our upcoming tweet chat during Black Maternal Health Week?
Absolutely. All information about our tweet chat, and I also see some questions about more information about Black Doula Day, will be made available when we release our Black Maternal Health Week Toolkit on March 15th. We will likely open up our Black Maternal Health Week activities with the tweet chat on April 11th, but you will be able to see those questions and get ready for that once we release the toolkit. Also, please remember that the recording of today's national call, including ways to directly send inquiries to some of our partner presenters today, will be made available on our Black Mamas Matter Alliance's YouTube page. And we'll also make sure to update that link to this recording on our Black Maternal Health Week web page on our website, which is blackmamasmatter.org/BMHW. Again, we are constantly updating the web page as we receive information and as we are collating all the information for our toolkit. So again, periodically check our web page, which is blackmamasmatter.org/BMHW. Thank you.
Thank you so much, Angela, for that information and ways for our folks to stay connected. We received a few questions about how folks can share their Black Maternal Health Week events that they're hosting in their communities. Would you like to give more directive around that?
Absolutely. Please be sure to utilize the hashtag BMHW24. You can actually do that now. Wherever your social media handles of your organization is, utilize hashtag BMHW24 to share out your flyers and everything that you're doing during Black Maternal Health Week. What we try to do here at BMMA is, as we follow that hashtag, we will retweet, reshare all of your information as we see it, and at the best that we can across our social media platforms. In terms of the local events, that is specifically to highlight our partners in our alliance, because of course there are hundreds, if not at this point, almost to the level of 300 plus events happening during Black Maternal Health Week across the nation annually. And so we're not able to upload everyone's flyers and information. However, we will do the best that we can as we see it through the hashtag, official hashtag, and uplifted and reshared across our social media. So you can go ahead and start using that hashtag now.
Thank you. Talk about staying engaged in our Black Maternal Health Week campaign. Last but not least, we received a question regarding how to request any BMMA related swag for any events that they are hosting during Black Maternal Health Week.
Yes, we're looking to, and hopefully to open up our swag store during the week. And Senabu, if you have any more information you want to uplift about that, feel free to share.
Yes, please do stay connected via our e-newsletter and our website, of course, our social media platforms, to be one of the first to know and get your orders in for some BMMA related swag. We are looking to have that live during Black Maternal Health Week and of course afterwards as well. So please do stay connected with through our e-newsletter as we share more time-sensitive and pertinent information through our e-newsletter and our Instagram and Twitter accounts. Thank you so much for everybody for sharing your questions and sharing your enthusiasm of Black Maternal Health Week. We want to thank you again for joining us today during our Black Maternal Health Week 2024 national call. Please, again, stay connected by signing up for our e-newsletter and following us across all social media platforms. Again, we thank you, and I hope you all have a great rest of your day and week.
Thank you so much to the team for putting this together.